Hi, I'm Joshua Hunter, Medicare Specialist on staff at McGinnis Elder Care Law. If you or someone you love is on Medicare, you probably already know that the annual Medicare annual enrollment period is almost here. What you might not know is that annual enrollment isn't the only enrollment period during the year. Here's a review of the most common Medicare enrollment periods. The first is the annual enrollment period, which applies to most people already on Medicare. This runs from October 15th through December 7th every year, which changes will take effect on January 1st of the following year. During the enrollment period, you can make changes to your coverage. This also applies to Medicare Advantage plans and Medicare Part D, also known as the drug plan. Starting in January 2019, Medicare is bringing back the Medicare Advantage open enrollment period. It will last from January 1st through March 31st. During this time, people with a Medicare Advantage plan can either switch to another Medicare Advantage plan or switch back to original Medicare. People already on original Medicare cannot participate. Please note that the Medicare Advantage open enrollment period does not act as a special enrollment period, so switching back to original Medicare may be risky without supplement or Medigap coverage. The next type of enrollment period is known as the special enrollment period. This covers special circumstances. In most instances, changes are effective the first day of the month following the month in which you made the change. If you're a Medicare beneficiary, you don't have to wait until the annual enrollment period from October 15th through December 7th to make changes if one of these special circumstances happens to you. For example, you change where you live, which changes your plan options. You moved into, currently live in, or just moved out of a skilled nursing facility or long-term care facility hospital up to 2 months after the month that you're discharged. Note that assisted living facilities don't count. You lose your current coverage, such as you are no longer eligible for Medicaid, you involuntarily lost other creditable coverage, or it is no longer creditable, like if the plan goes away or if you left coverage from an employer or a union, including COBRA. 2 other special situations give you freedom to change drug plans or Medicare Advantage plans throughout the year. These include becoming eligible for both Medicare and Medicaid, or qualifying for Medicare savings programs and or extra help Medicare prescription drug coverage. There's also a general enrollment period, not to be confused with the annual enrollment period or the Medicare Advantage open enrollment period. Now, it happens between January 1st and March 31st each year, and it's for people who did not sign up for Part A and or Part B when they were first eligible and are not eligible for a special enrollment period. For people who enroll here, coverage won't start until July 1. You may have to pay a higher premium for late enrollment. Well, that's a lot to remember. The main takeaway is that Medicare has a lot of rules, but there are sometimes exceptions to those rules. To learn more about Medicare enrollment periods and when they apply, go to medicare.gov and type Medicare enrollment periods in the search box or call 1-800-Medicare.